If you have diabetes, high blood pressure, high cholesterol, and you are discouraged, can I encourage you to focus on what you can do instead of being overwhelmed by the discouragement of being newly diagnosed with diabetes or being newly diagnosed with high blood pressure, high cholesterol? I know it can be a very stressful and discouraging situation. Can I suggest that let's focus on taking action? Let's focus on what you can do to the problem instead of focusing on what the problem might do to you. Take it one step at a time. Do one thing at a time. Do whatever that you're willing and able to. Work closely with your doctor. Join a program, join a support group. Do something. Many of my patients with diabetes, high blood pressure, high cholesterol, especially when they are newly diagnosed, many of them actually become quite overwhelmed, quite discouraged by the condition. And they may react in one of many ways, including one of being paralyzed with discouragement into inertia, into not doing anything. But can I suggest an alternative, better way instead? Instead of being discouraged, let's take action. Focus on taking action, one step at a time. Let's tackle the problem one step at a time. Of course, having diabetes, having high blood pressure, high cholesterol is bad news. But the good news is they are potentially reversible, modifiable, reducible, improvable, if there's such a word, by your lifestyle, by your diet. Focus on what you can do to reduce, to reverse, to retard the problem. Work with your doctor, work closely with your doctor. Go and join a program, go and join some health coaching, go and get some help, join a support group, take action. Take action. Instead of spending time going on YouTube, Facebook, Instagram, TikTok and gather information, instead of focusing on gathering a lot of information, piecemeal information that might even discourage you further and that might even confuse you further, instead of focusing on gathering information, can I encourage you to focus on taking action? I know it is challenging. I know it is discouraging. I can totally understand and appreciate that. Many people who come to see me as my patient or for one-to-one coaching, many of them come in a state of a degree of discouragement. They're feeling very down. Can I encourage you to focus on taking action to improve your lifestyle and diet? Simple things, if done well, can be very, very powerful medicine. It can be very overwhelming. It can be very discouraging. That is understandable. But can I encourage you that there is good news? The good news of diabetes, high blood pressure, high cholesterol is that you can do something about it. You can at least reduce it. You can at least retard it, or even in certain instances, especially when you do it early enough, do it properly with medical supervision, with the help of a program, a team, a coach, a doctor, you can even potentially reverse it through improvement, changes in your lifestyle and diet. When it comes to lifestyle-related chronic diseases like diabetes, high blood pressure, high cholesterol, we must not depend on pills alone. Whether the pills contain pharmaceutical drugs or supplements, we must not solely depend on pills alone. We must do everything we can. We must do everything that we're willing to improve aspects of our lifestyle, one habit at a time. Take each day, take each step at a time. Do whatever you know, whatever you're able to improve your diet, improve your lifestyle. Go for a morning walk if you can. Stop adding sugar to your drinks if you can. Start having more vegetable in your diet if you can. And simple things done well can be powerful medicine. Don't underestimate the power of simple habits done well. Would you agree with me? For those who are new here, I'm Dr. Chan. I'm a medical doctor from Singapore. I help people combat chronic diseases through lifestyle and dietary habits improvement. Because when you improve your lifestyle, improve your diet with a goal, objective, target of wanting to reverse your diabetes, high blood pressure, high cholesterol, and you fail to do so at the end of it in spite of your best effort, don't be discouraged. You didn't waste your time. It was not a wasted journey. It was not a wasted effort. 没了港，没有浪费你的精力，你的努力。Because in the journey to improve your lifestyle and diet, you would have at least you would have at least reduced the condition, reduce your risk of the complications from the condition. You would at least retard the condition from progressing that fast. 没了港。Every improvement in your lifestyle, every improvement in your diet will not be a wasted effort. If you have diabetes, high blood pressure, high cholesterol, you're newly diagnosed, I understand it can be overwhelming, it can be discouraging, but don't focus on the problem. Focus on the solution. there's something you can do. Focus on taking action, one step at a time. Right? Seek help from your doctor, seek help from your dietitian, seek help from your health coach, join a program, join a support network. Focus not on gathering information, focus on taking action. Simple action can go a very long way. Simple action that's done correctly, that's done consistently, can go a very, very, very long way in controlling, reversing, preventing, reducing, retarding many of the chronic diseases. Eat well and be well. Take care.